I was tagged on this Instagram post that said 58% of med students won't seek residency in states with abortion bans, creating health deserts across the nation. So that made me want to go ahead and look that up. What is that stat coming from? So this stat came from a Washington Post article. This paragraph says 1 year after Roe was overturned, this stifled learning environment appears to be having an influence on where medical students are applying to residencies. One recent survey of medical students found that 58% of those responding were unlikely to apply to a residency program in a state with abortion restrictions, regardless of their specialty. If people don't understand the blowback and the long term repercussions that are going to happen because of Christofascists' game plan to limit women's rights, it is evident, especially where we have seen states that are closing maternity wards. We're seeing physicians and nurses flee red states. And now you see residencies are going to be impacted, and women and girls will trickle down and stop applying for college in these red states. It is happening. Okay, so from the Washington Post, some abortion bans complicate medical training, risk worsening OBGYN shortages. So there's already a shortage on this specialty, and it's only going to worsen in red states, which will impact the people that choose to stay in those states. The journey to Boston was more than 1,500 miles. The plane ticket cost $500, the hotel another four. Amrita Bajia felt a little guilty about going, knowing that everyone could not afford this trip, but it was important. She was headed there to learn. So Bajia, a second-year medical student from Sioux Falls, South Dakota, caught that flight to Boston to attend a weekend workshop hosted by the American College of Obstetricians and Gynecologists. There, she joined medical students from around the country for a summit on smomorphin care. She learned about medication, practiced the technique of vacuum aspiration using papayas as a stand in for a uterus, and sat in on a workshop about physicians' rights. It was the most empowering thing I could have imagined, especially coming from a state where people don't talk about this stuff ever, said Bajia, an aspiring OBGYN at the University of South Dakota, a state where mammorphin is banned. Other than me flying to Boston to go to an ACOG workshop, I have no idea how to get that training. Even before the overturning of Roe, access to abortion training was uneven. Schools are not required to offer instruction on it, and students' experiences vary wildly based on their institution. But for Bajia and med students like her in states where it's been banned or severely restricted, those training opportunities have gone from not great to non existent. As a result of this insufficient gynecological training, experts warn a generation of doctors will be ill equipped to meet their patients' needs. And across the state, maternal care deserts probably will expand as graduating medical students and residents avoid some abortion restricted states. More than 30,000 students are training in states with restrictive bans, according to an analysis by the Hetchinger Report of OBGYN programs and residents. Another 1,400 OBGYN residents who are required to receive some abortion training as part of their specialty are studying in states where it's banned or severely restricted. There's a concern in states with these restrictions. Students are simply not getting enough training and exposure, said Jody Steinauer, an OBGYN medical educator and director of the Bixby Center for Global Reproductive Health at the University of California at San Francisco. There's really a worry that if this continues, you're going to be training a large group of OBGYNs who can't provide patient centered, evidence based care no matter where they practice. A related concern, fewer medical students will choose to become OBGYNs at all, fearing lawsuits or criminal prosecutions. Figures show that OBGYN residencies applications are down across the country, but programs in states with restrictive bans saw the biggest drop. Application rates for family medicine programs experienced a similar decline. Abortion is currently banned in 14 states, the Hetchinger report found. All offer a narrow exception to this blanket prohibition when the mother's life is at risk, and a few of those states allow it in cases of rape or incest. But doctors say guidance on maternal health exceptions remain unclear, leaving physicians vulnerable to potential prosecution when treating patients. Students are seeing us struggle with this stuff, and they're like, yeah, why would I stay here for this? Said Amy Kelly, a Sioux Falls OBGYN and clinical associate professor at the University of South Dakota, a state where doctors can face up to 2 years in prison for violating the state's bans. These developments are particularly worrisome in South Dakota and other rural states that are already struggling to recruit and retain maternal health care providers. More than half of the state's counties have no OBGYNs, and rural South Dakotans with high risk pregnancies often have no choice but to travel to Sioux Falls for specialty care. Limited access to maternal health care is reflected in troubling maternal mortality rates in abortion restricted states across the country where mothers are up to 3 times as likely to die because of their pregnancy, according to recent research. Barriers to abortion training could amplify physician shortages, increasing the number of maternal care deserts and posing even greater risk to maternal health. We already have a physician shortage in this country, said Pamela Merritt, a reproductive rights activist and director of Medical Students for Choice. And we have maternal health outcomes that come with that shortage. We have the worst pregnancy outcomes in the developed world. The last thing I want to see is people either having an insufficient education yet providing care, or people not even thinking of OBGYN as a specialty in certain states. Although medical students' curriculum vary, the Accreditation Council for Graduation Medical Education requires OBGYN residency programs to provide access to abortion training. Residents with moral or religious objections are allowed to opt out. It's a key component to OBGYN training, even for doctors who have no plans on becoming abortion providers. An OBGYN must be able to evacuate a uterus, whether the skill is used to care for a patient who has had an incomplete miscarriage, to remove polyps for cancer diagnosis, or assist someone who wants to terminate an unwanted pregnancy. And doctors in training can develop this ability through clinical abortion training. Such training is directly relevant to preserving the life and health of the pregnant patient in some instances. Yet, in states with these strict bans, direct access to that training has vanished. In the past year, program directors in those states have scrambled to find out of state training opportunities so their residents can fulfill OBGYN program accreditation requirements. But identifying and coordinating those training opportunities is no small feat. A lot of programs are grappling with the logistics piece of partnering with another institution to send a resident somewhere else, said Alyssa Caldwell, an assistant professor of obstetrics and gynecology at Oregon Health and Science University, who directs the university's OBGYN Ryan residency program. The university plans to host a dozen out of state learners for clinical rotation of 4 to 6 weeks during this academic year. Programs really need their residents for services they will provide. It's not the easiest ask to have a resident be gone from all clinical duties at their site for a month at a time. And this paragraph is what I read in the very beginning, where it's talking about residency programs in general being impacted. Just know and understand our healthcare industry is already broken. The Republicans and these red state restrictions will further impact people's health, and it's going to impact more than just women's health. It's going to impact more than women that are simply seeking to get an abortion. It's going to impact women who wanted a pregnancy and is having a miscarriage or some other female related problem. So this is what folks are voting for. They will be impacted as well. Jump in the comments. Let me know what you think about this one. Don't forget to like, comment, and share. I've talked about this before. women and girls will leave red states. One of my YouTube subscribers called them stag states because they are going to be left with a bunch of men as young ladies exit these states that have restrictions on women's rights. So this article was from last year. It's titled "Red State Colleges Face a Smorgasbord Headache." They're facing this because women and girls are leaving these states. They're not going to be applying at colleges and universities that have these reproductive right restrictions. Well, and we'll see these numbers as time goes on. These are not numbers that we're going to see immediately. This is going to happen as parents plan for their daughters to go off to college. A growing number of female college applicants may seek to avoid going to schools with states where abortion is banned or severely restricted. While the long term impacts of the U.S. Supreme Court's decision in 2022 overturning Roe on college enrollment around the U.S. remain to be seen, research, polls, and reports are already showing an increasing number of young women are factoring in these laws when making decisions about where to apply for college. It was a consideration for some female applicants even before Roe's demise, according to research recently published in the Journal of Economic Letters. In the study, which used data from colleges ranked in the top 100 from academic years 2018 to 2022, showed that there was nearly a 1 percentage point decrease in the share of female applicants to institutions in states that ban abortion compared to states where it's still legal in 2021. This suggests that undergraduate applicants are sensitive to state reproductive health policies and that this may impact the demographic composition of colleges and future labor pool of those red states. And keep in mind, remember this, more women are going to college than men. So that is going to severely impact how the makeup of these states in particular. This is going to be big, especially since more women are leaning liberal and more men are leaning conservative. So what will these states look like? The students in question were applying to colleges in late 2021 as an anticipation regarding the possible reveal of Roe was heating up, says Rajiv Sharma, one of the students' co-authors and a professor at Portland State University, told Newsweek. It is possible that these effects will be stronger for subsequent cohorts because state policies regarding access to reproductive health that were merely anticipatory for the fall of 2022 cohort are much clearer for subsequent cohorts. Towards the middle, this quote, "My daughter was very concerned about abortion access when she applied to schools," Rosanna Kahn, mother of an MBA student at Drexel University, told the Philadelphia Inquirer last month. Her 20-year-old daughter is studying public health at Gwinnett Mercy University in Pennsylvania, where abortion remains accessible. If heaven forbid she were to get pregnant, Kahn said, "She and I know we need to be around here where she can quickly get it taken care of and move on with her life rather than be living in some place that puts stringent restrictions on women." Some mothers in Texas, which has one of the nation's strictest bans, have shared on social media that they intend to send their daughters out of state for college. College counselors have reported parents and students ruling out states like Texas when considering which institutions to apply to. We do have kids and parents make comments about red versus blue, conservative versus liberal. Jennifer Schlegel, the co-owner of My Admissions Sherpa, which guides students through the college search and admissions process. Very often the mother will say, "No red states." Meanwhile, universities in those abortion banning states where a large number of students come from out of state are likely to feel the biggest impact. The Washington Post last year noted that Rice University in Texas had a quarter of incoming freshmen in 2020 come from states where abortion remains legal, such as New York and California, while 40% are from Texas. The university has been contacted for comment via email. Polls have also shown that current and prospective students are factoring in laws governing reproductive rights when making decisions on where to go to college. A survey by Intelligent.com shortly after Roe was overturned found 26% of prospective students would only consider attending college in a state where abortion is legal. Meanwhile, research from the Gallup and the Lumina Foundation earlier this year found that a majority of college students, 72%, said health laws in the state where college is located was at least somewhat important to their decision of whether to stay enrolled or leave. But such decisions will likely be limited to students who have the privilege of choosing the state where they attend colleges. Students whose choice is limited to college within their home state for financial or other reasons will likely be sensitive to state policies which when making their college decisions. So, this is going to be interesting, and this is going to be the repercussions that happen like 5 years down the line, because there's still kids that are in high school that are still making these decisions, and where will they go? This will definitely impact where women decide to land as far as getting a job, where what state they're going to stay in, and like this is saying, where they will go to school overall. This will impact economies. This will impact economies, and data will data and numbers and money will tell us the story of what these red states, these Christofascists, these forced birthers have done to their states as far as restricting women's rights and how that will translate to dollars and cents. Go ahead and weigh in.